Hi, I'm Jessica Anderson. I'm a certified nurse midwife at the University of Colorado Hospital Center for Midwifery. Today we're going to talk about water labor. Water labor can be used at a variety of times during the labor. Women can get in and out of the water during their labor. Water labor can be wonderful for women who are not wanting to birth in the water. Often women will get in the water, labor in water when they feel like they have to push, then they will then get out and actually birth on land. Water labor is a great modality for women to use if they're planning to avoid medications completely or delay them before getting IV pain medication or an epidural. Water labor is very easy to use, it's safe, and women get many benefits from utilizing it during their labor. Water labor can be used at a variety of times in your labor. It can be used even if you're at home actively laboring, or you can wait to utilize it when you get to the hospital or to wherever you're going to be giving birth. It is good to talk with your provider to decide when it is the right time for you to get into the water though. The benefits of water labor is that it decreases anxiety, it decreases your pain, it promotes relaxation. There's some thoughts that it can also help with labor progression. Often women feel that they are extremely safe when they're laboring in the water. Often women will describe it as they feel like they are in their cave. Many women, when they get into the water, feel like it's just as good as getting some IV pain medication. So it's a wonderful pain modality to use while you're laboring. Other things with the water is there's some thought that it can also help your labor progression. It can create buoyancy. Women can move easier in the water. There's some thought that water labor also decreases the use of interventions, and the biggest piece is that women are very satisfied when they use water for labor. Water labor is not right for everyone though. There are certain women, based on their pregnancy complications or risks, or things that are going on with their labor, that should not labor in the water. For example, women who have a uterine infection, have a fever, are having heavier vaginal bleeding, or maybe preterm may not be the right individual to labor in the water. Some of the risk of water labor, which are very few, is that there is some thought that if women get into the water before 5 centimeters, it could slow the progression of labor. Water labor is not appropriate for all women. Some women, based on their risk status or what is going on with their pregnancy or labor, are not appropriate to labor in the water. For example, women who may have an infection, a uterine infection, should not labor in the water. If there's any concerns for the baby's heartbeat, if you're having a large amount of vaginal bleeding, or if your provider doesn't think it's the right place for you to be during your labor, it's probably not the right place for you to be. It is best for you to talk to your provider to decide when it is best for you to get into the water. To get the maximum benefit from water, you want to make sure that the water covers your abdomen completely. You also want to make sure that the temperature is between 98 and 100 degrees. It is important for your nurse or healthcare provider to check the temperature of the water frequently. It is also important for women to make sure that they are drinking fluids while they're laboring the water. Often women get dehydrated when they're laboring, and this is more likely to happen if you're laboring in the water, especially if you're getting too warm. It is also important to think about the safety aspect of water labor. It is important for you to have a family member or support person with you at all times when you're laboring in the tub. In addition, you want to make sure that you're getting help out of the tub so that you do not slip and fall. It is important for your healthcare team to clean up all water spills so that no one slips and falls and gets injured. Some nice things to help promote comfort while you're laboring in the tub is to have a pillow for your head. Make sure you have some fluids to drink. You can have some music and candles set up around the tub. The tub that you're utilizing for laboring in the water should be cleaned between uses. One of the concerns that are out there in our communities regarding water labor is that there's an increased risk of infection for mom and baby. We have adequate data and research studies to say that there's no increased infection rates for either mom or baby when you utilize water for labor. It is always great to talk with your healthcare provider before choosing any modality for your labor and birth.